Good morning, everyone. This is Liliana, and I'm so excited to be with you this morning to share a little more about redefining community-based rape crisis centers' roles with campus-run gender-based violence programs. Just a quick overview of today's learning objectives. We'll be providing an overview of the campus landscape, entities, and policies relevant to gender-based violence in response to prevention, in violence response and prevention. We'll also go through the fundamental topics such as Title IX, student conduct, and CCRT structures will be discussed in relation to RCCs as well. And the purpose is really to improve sustainability for campus-based prevention and response efforts. And so we wanted to start by understanding the campus layout. And part of this is just a little glance at the 2017 fall enrollment for UCs across California. The UC fall enrollment at a glance outlines the ethnic and geographical makeup of the fall enrolled students. And this is really good to look into in the college campuses that you serve to really understand the demographics in that area, in that specific campus, and how do you provide services and share the services available. So it would be really helpful that you understand that if you're working with a four-year college or a two-year school, that you really start learning and informing yourself on who is part of that campus. Specifically when we're talking about the four-year UC system campuses here, the top three countries sending international students in California is China, India, and South Korea. And I would really encourage you again to follow up with the campus that you serve to identify what the ethnic group and the geographical makeup of your campus is. We wanted to start by sharing some statistics that maybe you all are really familiar with, but in order for us to really build CCRTs and services and prevention models, we really need to understand the purpose and why we need to have these programs. And these statistics really show the importance of the RCCs really connecting with their campuses and providing that support, and also in finding out ways that you can better connect with your college campuses. So just to highlight a few, 5 to 6% of men will experience sexual assault during college. 90% of campus sexual assaults are committed by perpetrators that the survivor knows. 13% of women report being stalked during their time in college. And 43% of dating college women report experiencing violent and abusive dating behaviors, including physical, sexual, technology-facilitated, verbal, and other forms of controlling abuse. There are a few student survivor-specific estimates of the cost of violence. The White House noted for rape survivors, studies found that costs range from $87,000 to $240,000 per rape. And again, we know that it has an economic, impact for survivors of sexual violence. And there are very few studies that specifically measure violence perpetrated against undocumented immigrants. Even so, it is clear that undocumented immigrants are less likely to report violence against them for fear of deportation. So what are some of the impacts and barriers of gender-based violence? As you know, as you're working with college campuses, it may disrupt students' education and social ties. It may have immediate and long-term physical and mental health. We know that it has an economic cost for survivors of sexual violence, and there are high rates of stalking. Also, some of the impacts and barriers may be the Greek cultures. They may be promoting an environment of toxic masculinity. And international and undocumented students may have fears about reporting incidents of violence because concerns of their immigration status. So how did we get here? Title IX and all of this work on college campuses really started from student activism. They really pushed to raise more awareness of Title IX and also the Clery Act. They exposed a lot of the issues in campus response. And it really led to the strengthening in VAWA of 2013. And so we really encourage you all to go to visit the It's On Us website to find more information on this. But as we do a quick overview of Title IX and what are some of the takeaways, it applies to all schools that receive federal funding, has a right of action. Individuals can sue under Title IX. It includes sexual assault, sexual harassment, and sex discrimination. We also find folks who are considered responsible persons or responsible employees who are staff and are mandated to report to Title IX if a student were to disclose a sexual assault occurring to them. There is a Student Bill of Rights. There's also the ability to have a disciplinary hearing, and there is access to legal support as well. Then we look at the Clery Act. It came out of a case of a student being raped and murdered in her residence hall in 1986. Her name was Jean Clery. And the Clery Act is really seen more as a security measure. Jean Clery, it's a reporting of the crimes that are happening on campus. And just so we keep Jean Clery in mind when we're looking at the Clery Act, she was 19 years old when she was raped and murdered in her college dormitory. And her parents, Connie and Howard Clery, could not have known the danger she was in. So standards for campus crime reporting simply did not exist in 1986, and they really pushed for this act to come forward. And so Clery's, some of the takeaways include college-specific safety considerations, has an annual reporting mechanism or the annual security report that should be made available to all students and any parents who are also looking at college campuses that their children might be looking at. It has a security focus. They are sending timely warnings on emergency situations. They report the violent crimes that occur. And Campus Security Authority is reporting under Clery. Really what Clery covers is the what, where, who, and when of the campus. So what crimes that continue to pose a threat, any significant emergency or dangerous situation that poses an immediate threat to the health or safety of a student or employee. The where can be on campus or non-campus, including public property that falls in your Clery Act geography. On campus, only including on-campus public property that falls in your Clery Act geography. And the who is the entire campus community. It can be tailored to the segment of the community that is threatened. And the when is that sent when enough information is available to adequately describe the threat, sent immediately upon confirmation of the threat. And again, these are sent through these timely warnings via emails, and many of the students are aware of these timely warnings that are sent to them in case of a problem on campus. And then we look at the California state law, and this can be really kind of a treacherous thing for survivors to go through, but we do have some takeaways for the California state law, which I'm sure many of you are really familiar. There is an affirmative consent standard. SA and DV counselor privilege still applies. There is a requirement that MOUs with law enforcement be put in place with the campus, local rape crisis centers, and law enforcement agencies. They're really there to create these MOUs to the extent as possible, And really that's an opportunity for rape crisis centers to connect with their college campuses and ensure that they're part of the MOUs that were developed and created for the response of sexual violence. And of course we know that state law is rapidly changing landscape, and so keeping up to date with what's happening with the law in regards to sexual violence. They do have rights, victim rights, which we all know, and I'm sure you all are very familiar with. And they have access to victims of crime money without reporting. And so the beginning part of this portion is just kind of to really prepare you in understanding the basics of Title IX, Clery, and the California state law. And I'm going to pass the time over now to Leah Aldrich, who really will talk about combating gender-based violence on campus.
Thank you, Liliana, and welcome everyone to this morning's campus conversation about the role of gender-based violence and sexual assault organizations and our relationship to that issue with campuses. So what we found in doing the campus work for, over 20 years, or almost 20 years now, the Violence Against Women Act passed in '94, and the Office of Violence Against Women at the federal level began funding campus-based projects to combat sexual, domestic violence, dating violence, and stalking back in 1999. What we have learned is that consistently there are three main areas that have demonstrated that they are a best practice for people doing comprehensive campus-based work to intervene and prevent on those issues, and that they have a focus on making sure that when they are responding, that their response is trauma-informed, that they are centering the needs of survivors, and they are thinking about improving, healing, having positive impact, and moving that survivor towards a space of healing. That may seem like it goes without saying. However, we have to remember that colleges and universities, 2-year schools, 4-year schools, and so on, that sexual, domestic, dating violence, and stalking are not their primary responsibilities. So they do not necessarily bring healing and recovery from a trauma-informed approach to the fore. That is not what they do on a daily basis. So it becomes incumbent upon them to work closely with those of us who do have that focus. And then we have a responsibility to make sure that they have the proper skill set and the support to be a first responder frequently from a trauma-informed perspective. The second large thematic way in which people can have a really successful campus-based project is to make sure that they are engaging communities and that they're collaborating, that they're having strategic partnerships with people on campus as well as off campus. Characteristics for many campuses is that they operate in a very siloed, compartmentalized way. And because of that, not only do they operate in a siloed and compartmentalized way on campus, but they also tend to be closed networks or closed systems, which means that they don't necessarily have to forge long-lasting or substantive relationships with community entities outside the boundaries of their campuses. So they have these closed systems where they, in many instances, provide everything for the students. Maybe they have student housing, they have food, they have health care, they have student jobs, and so on and so forth. So there's a kind of a one-stop approach to being a student on a lot of 4-year schools. For 2-year schools, they tend to be heavily commuter schools, and so they don't necessarily have the same kind of on-campus self-containment, but they nevertheless seek to deal with issues or liabilities that impact their campuses internally. So it's been very challenging in some instances to get campuses to open up and allow community-based organizations to come in and support them in creating better climates and environments for student bodies. But we know that it creates a greater degree of accountability, but it also opens them up to a tremendous amount of resources to both intervene in and prevent sexual, dating, domestic violence, and stalking. And then the third area of concentration is to offer comprehensive prevention strategies and programs and activities and so on. Prevention is something that both our community-based organizations as well as our college campuses struggle with. But you know, it's been around just over almost 30 years looking at comprehensive prevention work around violence. And we're all growing together in this, but it's important that the comprehensive prevention be not to have a single focus, but that it have multiple strategies, that they're very clear about the outcomes that they want to see change, that they operate at different levels, not just with individual students, but that we're also talking about trustees and chancellors or presidents of campuses. So throughout the entire campus, that we want to make sure that we are saturating the campus with efforts to prevent as well as respond to gender-based violence. So with those three broad understandings of what campuses need to be doing in order to make their campuses safe and free from gender-based violence, I'd like for us to take a moment and think about what are the different ways that our organizations can contribute to trauma-informed approaches, community collaborations, and comprehensive prevention. Many of us are currently doing various activities with college campuses and universities. Frequently, we're either delivering education in classrooms, or we are participating in Take Back the Night rallies or clothesline projects. Some of us are doing theater-based education. But the work of the rape crisis centers in the future it has, and in the future will change dramatically as campuses become more savvy and skilled and experienced at addressing these issues on the campuses internally. So for the work that when we think about doing this work, comprehensive is unclear frequently for a lot of people. So we just wanted to break this down a little bit about what we meant by comprehensive elements. So when we talk about advocacy, our rape crisis centers in our communities are very, very skilled at being advocates or speaking on behalf of. But we also want to think about how advocacy functions as a form of prevention, specifically tertiary prevention. When we think about primary, secondary, I'm going to skip ahead just real quick and take people through looking at the ways in which prevention are broken up on different levels. We think about primary prevention. We want to get to large segments of the population. It's very population-based, not individual-based, but population-based. We want to get to them before any incidents of violence have occurred. Once people have been exposed to or at risk for violence, we find that we engage in secondary prevention, and it's an immediate response to violence once it has occurred. And then tertiary prevention is more intensive, more response or resource heavy, more of a drain on resources or taps resources more deeply. But that's when we're looking at having to triage, house, shelter, and the like. So as we move across the various types of prevention from primary to tertiary, we find that with primary prevention we have larger populations of people that are exposed to prevention strategies, and as we get to tertiary prevention, the populations are reduced in numbers, but the amount of impressions or interactions with those individuals becomes more intensive and more resource heavy. So we definitely want to make sure that we're reaching larger populations of people with these strategies, not only because it's cost effective, but because you stand a greater chance of having long-term community or norms change. So in thinking about our comprehensive elements, when we think about advocacy, working with survivors, advocating via systems, whether we're working in a hospital with law enforcement or in a court system, their academic situation, and all of those kinds of engaging with survivors in the various systems, advocacy can be considered what we would be a form of tertiary prevention. If we, again, keeping in mind that prevention is an umbrella that encompasses wanting to keep things from ever occurring in the first place, but also responding should something occur. When we think about outreach and awareness, this is where many community-based rape crisis centers are when we go into classrooms and we're doing our education, when we're having tables at fairs, when we are showing up at brown bag lunches in corporations and delivering information. This is where we usually talk about our services. This is where we have recruited for volunteers and other supporters. We can think about this as a form of primary prevention. We are assuming that no one is in a crisis state of being and that we are trying to get to them before they are exposed to or made at greater risk for anything like that. Risk reduction also, perhaps you're familiar with risk reduction in the substance abuse arena. This is where we are trying to mitigate against the long-term negative impacts of being exposed to or engaged in high-risk behaviors. So for risk reduction, this is where we are telling domestic violence survivors to make plans, gather belongings, doing what they can do to reduce the impact or the probability. Again, it's of violence occurring, erupting in their relationships. This is not about blaming victims, but it's about mitigating against. It's reducing the level of injury that could occur should an act of violence or injury happen. This is the same thing that happens when we talk to largely female populations about walking to cars and safety and where you park and keeping your keys in your hands and paying attention to your cocktails when you're out and so on. That's risk reduction. And again, that is a form of prevention as well. And we can consider risk reduction a form of secondary prevention. And then our primary prevention, again, is where we're looking at getting there before any incidents of violence occur. These interventions address root causes. They emphasize what the risk factors are and what we need to do to reduce the risk factors and increase our protective factors. So as we are in our practices, when we think about what college campuses have going on from the public health approach and thinking about preventing violence, there are several models that are out there to help us think about, again, being comprehensive, right? Not one strategy. It's not just about tabling. It's not just about speaking in a classroom. It's not just about having crisis response services, but it's about offering all of those different approaches at various levels throughout the college campus community. So perhaps you've seen this model. This is what they call the socio-ecological model, where strategies are nested within one another, right, because they build upon one another. So we're looking at what happens with individuals, what happens with relationships that extend beyond those individuals. We're looking at what happens within organizations, and we're also looking at what happens within broader communities, again, because individuals live within communities, right? So we see that in the ecological model, things are nested. So if you can see some of the examples that are identified here, there's a lot of examples of a lot of different things that people do, but it's important to pay attention to the way in which things kind of grow in terms of population and in terms of reach and depth as we move from the individual level to the community level. So if we're looking at the individual level, we're talking about things like engaging students to include information about sexual assault and domestic violence or dating violence in papers that they may have to write for school, right? So we're looking at integrating these strategies into the day-to-day existence of students, faculty, staff, administrators, community partners on college campuses. Again, at the individual level, we're looking at how we involve parents in this in the campus lifestyle. We're looking at making sure that campus health centers are trained as individuals on how to recognize warning signs. We're making sure that the education that individuals are receiving is not just about how to what to do in the event that crisis occurs, but how to be a prevention advocate themselves. Sometimes people are using bystander intervention programs, or there are other programs that are out there, but that are really looking at getting individuals to change their attitudes, their knowledge, and their behavior around preventing violence and not accepting the idea that violence is inevitable. If we look at what happens with relationships as we extend out, and we've had that kind of impact with individuals, now we're looking at the relationships, how they engage with one another. We're looking at mentoring, pairing people with others so that they are reducing risks and increasing protective factors. So one of the statistics that Liliana mentioned earlier, involved the red zone on college campuses, where you have incoming freshmen are at great risk for sexual abuse within the first half of their first semester on a college campus. Well, pairing them up with a mentor, with an older, say, with an older student, an upperclassman, reduces the probability or reduces their risk for violence and victimization. Right? As we move into the organizational level, we're thinking about how entities or individuals or groups or clubs internalize their prevention strategies. How do they embed it in the day-to-day work that they do, because they are then impacting large populations of people. So we have coaches who, as part of their orientations for new students and ongoing communication with students, are talking about how violence is not acceptable and not appropriate, and that there will be sanctions if you engage in this behavior while you are an athlete in this school, right? So we're looking at the kind of impact that the organization and the kind of support that organizations and entities can put behind supporting the prevention strategies. And then when we look at the community level, we're looking at what are those protective factors that everyone in the community can be exposed to. So we're looking at media. Maybe perhaps there are public service announcements, perhaps on the campus website that students and faculty go to where there's high traffic. We're putting ads or mentions about preventing dating, domestic sexual violence, and stalking. Right? But what's key is that you not just do one of those elements at one of those levels, but that you find ways to have impact that ripples or that reinforces all of those strategies, so that you are in effect doing something, you are providing what they call multiple dosages of those strategies and the messaging that goes along with those strategies. So when campuses are looking to put together their campus-based projects, again, thinking about how the language is similar to what's in a lot of the proposals, either for OVW or for California Office of Emergency Services, who will be funding campus-based projects. The language is very similar to the three-pronged approach that where we previous slide we looked at that talked about trauma-informed, community engagement, comprehensive prevention. The language that they typically use is that they want effective intervention or effective response. They want broad campus and community engagement, and they're looking at the reduction of gender-based violence. So that would be the language around prevention, is the reduction or the prevention of. So they put things in to reduce the probability of there being occurrences of sexual violence, domestic dating violence, and stalking. So let's talk for a moment a little bit about the CalOES model. So the California Office of Emergency Services has modeled a funding opportunity for the state of California after the federal model for working on college campuses. Again, the three-pronged approach, that there must be effective response, there must be effective prevention, and there must be effective community engagement. The CalOES funding is allotting up to $4 million. Applicants can apply for up to $200,000. You can imagine that's not a whole lot of money for college campuses. But the great thing is that it's a great start. CalOES has recognized the need for the state to participate in prevention and effective response, and that this is not just for four-year schools, but it's also for two-year schools, which are sorely and sadly underfunded and under-recognized in this area. So we want to encourage our local community-based agencies, if you have relationships with schools, to pay attention to this opportunity. Now, these are the requirements for eligibility. I will just draw your attention to the requirement is that they partner in a formal way with a community-based sexual assault or domestic violence organization, or sexual assault with a local rape crisis center. Or it can be a DV or domestic violence organization, as long as they have sexual assault programming under their roof. If they are currently receiving an OVW grant, or if they are currently funded under the CalOES pilot project for campuses, they are not eligible. So this would be for new schools. They must also hire or allocate some of their resources from this project to have officers, campus safety folks dedicated to working on this particular issue. So they must partner with a rape crisis entity in the community, so keep that in mind. These are the different components that go along with their campus-based project. Again, effective response, effective prevention, and effective community engagement. So they have to create something that's called a coordinated community response team, and then we'll get into a little more information about that. They must provide services for victim survivors. I have bolded some of these so that I want to draw your attention to those, because those become places where our community-based organizations can have a presence, and we'll talk a little bit more about that later on. But they must provide due process around investigation and coordination of responding to complaints, Title IX complaints, training, comprehensive outreach and prevention, dissemination of information, co-location. That means that the law enforcement as well as the community-based sexual assault program is co-located on the campus, and that they participate in community-based multidisciplinary efforts, and that they are having formalize those relationships, and that they will look to CalCASA for their technical assistance and training. So just a little bit about the, no, I'll come back to that. Okay. So the Clery Act Campus Rape Crisis Center participation is really heavily focused on making sure that these college campuses are building stronger community-based relationships. And so here we have the actual language from the RFP that Clery has put out for their funding project. So it's explicit. If you need to show it to a 2-year or 4-year school that you want to approach about whether they're applying for this or not, if they don't know that they must partner with a rape crisis center, here's the language that is readily and easily accessible for you to share with them for their eligibility. So while we understand advocacy and how to work on behalf of individual sexual assault survivors, victim survivors, these types of projects really compel the community-based organizations to redefine, in many instances, our role in working within a system. So the traditional role of community-based sexual assault agencies has been one of understanding how these institutions operate and how and when to advocate. We have demystified the processes for survivors so that they understand what next steps are or what options are available to them or what referrals and resources they can go to move their healing process along, or how to advocate for the need of accommodations should students need certain particular kinds of interventions that will allow them to just make it through the regular school year, and then just to provide ongoing support. Many of the colleges have, over the years, sought to have their own campus-based advocates. They hire them, they're staff and employed with the schools, and the intent, it seems, has been to be an effective responder to the needs of survivors once they happen on campus. So again, the same way college campuses provide housing and health centers and social activities, as sports activities, entertainment, as well as education, they're also wanting to make sure that they are or to be a facilitator in the healing process for sexual assault, domestic violence, dating violence, and stalking. So here we have a side-by-side comparison of the differences between the campus-based campus-employed advocate and the community-based advocate. And some of the biggest distinctions you would see historically has been that community-based rape crisis center advocates have they provide services beyond what that particular system, that individual system, can do. So we're thinking about law enforcement, education, medical, and faith. We can provide them with access to various systems and institutions. But the biggest thing that we did differently than what campus advocates and campus employed advocates did was that we had confidentiality and privileged communication with survivors. The campus employed advocates were not they were not covered under privileged communications and were not required to maintain a certain level of confidentiality. Also, it's important to keep in mind that our community-based organizations are typically available 24 hours a day, 7 days a week, and that we are specialists and that this is what we do, for a living. This is what we do all day, and so we have a particular kind of expertise that we bring to working with college campuses and their students and their entire community, and so on. So, here's a side-by-side comparison. However, in January of 2019, Assembly Bill, is it 1989? I think it's 1896. I will double check, but I'm pretty sure it's Assembly Bill 1896, so I might have been feeling a little dyslexic when we put this together, so my apologies. But I'm pretty sure it's Assembly Bill 1896, which amends the evidence code in terms of who shall have privileged communication with sexual assault survivors, so that this language now says that the sexual assault counselor for these purposes or a person who is engaged in a program on the campus of a public or private institution of higher education with the same primary purpose of rendering advice or assistance to victims of equal assault and the same qualifications. So it appears now that the campus employed advocates will now, under AB 1896, it is AB 1896, will now also have privileged communication and confidentiality with survivors. So what does this mean for our local rape crisis centers? It means that the local rape crisis centers want to continue to engage with campus communities in activities and in planning and actions and strategies that include not only effective response on a one-on-one basis and helping survivors heal and recover from abuse, but that we are also finding other ways to be of service. And the coordinated community response teams are typically the place where we can locate ourselves for the broader campus. So that means that beyond providing one-on-one individual counseling, we have to find ways to participate in their planning and the development of policies, in the effective community engagement, in the prevention strategies on those multiple levels in the comprehensive prevention programming. So we now want to make sure that we are having impact at the individual levels, at those relationship levels, at those organizational levels, and at those community levels, which means that we will be doing a lot of work that is not what we have done in the past. It means that we will be doing work beyond meeting with individual survivors. Because our organizations are typically 24/7, 365, we will still be of service around crisis response and counseling because the campus employed advocates are typically kind of regular employees in a kind of a 9 to 5 or maybe even an 8 to 6 kind of configuration, but they're typically not covering or providing those resources and services on the weekends and at night, in the middle and overnight. But now we have to extend our capacity to be a solid resource for campuses beyond crisis counseling. And so the CCRTs become a place for us to become more engaged and filtered throughout all of the various strategies that campuses will employ to reduce and prevent sexual violence. So here we have an example of what a campus community response team could look like. We have in the center, we have a core team, and with that you can see the populations or the staffing at the college level of who would be involved in making key decisions with regard to their campus project. We have a Title IX director, we have student health folks, we have public safety people, we have student judicial affairs, and the like. So those are the people that would be responsible for paying attention to the comprehensive prevention, comprehensive or effective response, and community engagement. They're kind of dealing with this effort on a daily basis. Now, over the years, what was discovered was that many people, the work for this project and this type of work fell on the Title IX coordinators because Title IX, as within the Office of Civil Rights, it's a justice issue, and this is where this work was located, right? Because it was not necessarily about a criminal response as opposed to really wanting to change cultural norms. So it was located within the Title IX office. What they found was as though that in order for the effort to be more successful, these efforts really needed to have a project director that was separate from the Title IX coordinator. So to that core team, a project director or a project coordinator that oversees all of the different efforts. You can see that when we think about who should be involved in a campus-wide effort, being the Title IX coordinator and managing this program is too much work. So it was essential that they came many years later and said, we need you, as you design your projects, you must have a project director that is not the same person as your Title IX coordinator. If we think about your core campus community partners, now we're rippling out. Now we're emanating out. We're bringing in other people who have impact and contact with students, other faculty, administrators, and staff. Right? So these people can include like Res Life people, athletic directors, student faith, and disability services. So now we're looking at how do we saturate the campus? We're thinking about that middle ring. Who are the early adopters, if you will, that need to be brought into the conversation or brought to the table to ensure that whatever the program directives become, that they are carrying forth those messages. And then when we see our community partners, that's where you see people have their sexual assault and DV organizations, that they have community-based municipal law enforcement. Sometimes they'll have city attorneys or district attorneys. Maybe they'll invite a SART nurse from the local hospital to be part of those conversations. Many campuses have many different structures. This is the simplest, and it tends to be the one that allows for the most effective functioning of all of the different moving parts of doing a project like this. Some schools don't have their own law enforcement, so they have to outsource to local municipal law enforcement. Some schools don't have campus health, so that they bring in local community SART nurses to be part of their campus effort. CalCASA would like to work with you all as you approach your different schools to help them identify the structure that would be the most effective for the resources that they have, both on their campuses and in their surrounding communities. So it's all doable, but this is an example of one example, just one of many examples of how this can be effective and how people can organize themselves around the many components of the project. So here's some advantages, and looking at the advantages of making sure that we are having these team approaches. The effort is too big, right, for any one or two or even four entities to take it on. Just looking at something like a local campus here in Los Angeles, University of California, Los Angeles has over 40,000 students that attend the campus. That's just the student body. That does not include faculty. That does not include employees, administrators, and so on. So in order to saturate a campus, if that's the goal, to saturate a campus and say that we are a gender-based violence-free campus, right, it is going to require us to broaden the ownership of making the campus safer, right? Logistically, no one agency can successfully handle all of various aspects of reducing and intervening and preventing sexual violence, domestic dating violence, and stalking. And the more people are integrated and talking to each other, the more that we can prevent people and places and things from falling through the cracks, right, and so on. So we have to increase our communication and engagement with one another. And let's see. Okay, so I wanted to talk for a minute about this idea of sustainability. Having a coordinated community response really improves the likelihood that efforts that are begun will be sustained over the long haul, right? When we're looking at improving policies and practices, we're looking at routinizing these practices, that we just make it part of the everyday experience of being affiliated with the college community and the college campuses, then we normalize the idea that we can have campuses that are free from sexual, dating, domestic violence, and stalking. When we are engaging via systems, whether that be the way that college campuses are broken down into different units or departments or colleges, whether we're talking about the affinity groups on college campuses, Black Student Union, La Raza, Hillel, students with disabilities, Veterans Affairs, and so on. When we engage these various components of the college campus, and we have, then in that way we can ensure that students will receive consistent messaging all of the time, no matter where they go on campus, and so that we sustain our efforts when multiple parties are doing their part in the heavy lifting to having a violence-free campus. We want to make sure that we are planning and anticipating. That means that if they are doing strategic planning annually, or that they're revising and looking at the scope of their services and their efforts, that they're constantly checking in. All of these are methods of sustaining their efforts. It will give them opportunities to make course corrections, that they are doing evaluations. That is critically important, that people are evaluating the effectiveness of their work. And again, that allows you to say, oh, this works really well, this doesn't work well. We can shift those resources from what's not working well over and do more of what is working well, and so on. And then again, these are the ways in which we provide greater sustainability. When we look at language that's embedded in job descriptions and in course syllabus and the like, those are the ways in which we routinize this work, and we increase the probability that the work will go on without us. So all of these efforts are not only meant to have an immediate impact on survivors and to improve the climate and culture of the campus in the immediate term, but it will also ensure that over the long term, the campuses will be able to sustain their efforts and be able to claim that they are a violence-free campus. So, and you're talking with 2-year and 4-year schools, you want to make sure that you are bringing up that the work will be sustained if we pay attention to these different kinds of elements. We want to make sure that we're having community integration, that we are looking at the various systems, that we're looking at language and policies and protocols, that we're routinizing our practices, that we're constantly planning and strategizing and anticipating, that we are not wavering, that we're branding our efforts, and that we are evaluating the effectiveness of our work. We must do that. I wanted to direct your attention to some resources that CalCASA has developed for our campus efforts. All of these are available on CalCASA's website, but we also have hard copies of all of these reports. If you're interested in obtaining copies of some of these materials, feel free to send us an email at info@calcasa.org. And we also wanted to point out that there were some other numerous resources out there that are available for those of us who are linking up, connecting with campuses that will improve their chances of having a violence-free campus. I wanted to ask at this point if anyone had any questions. Okay. All right. Well, with that, I want to thank everyone for their attendance today. And again, if you have any questions, definitely feel free to reach out to CalCASA, info@calcasa.org. Thank you, everyone.